You guys, I have a freaking bombshell. A freaking bombshell. Okay, you guys. So remember when Cordea got injured, right? My mom told me because she had to go in the rehab facility before. And she said that does not look like a typical hospital. She said that looks like a rehab facility. I said, what you mean, Mom? She said, you see all that equipment out? She said, hospitals want to have equipment out like that, right? So we did some more research. Turns out that's dialysis equipment. That was a acute rehab facility. I'm gonna give y'all the name of this facility, okay? But let's walk it through slow, okay? It says seeing, and then if you notice the part where they're going out of the facility, it's an elderly woman sitting on the bed in the hallway. She's like elderly or middle aged or whatever. Now, that's not typical of a regular hospital setting. That's more like a crowded rehab facility, right? And I'm going to tell you why they went to a place like that and not a regular pediatric hospital, okay? It says, seeing an elderly patient in a hallway bed at night strongly suggests a crowded rehab facility or nursing home, which is a highly unusual place to take a child for emergency stitches. In standard hospital or ER, pediatric patients are prioritized and kept in private sterile rooms. Taking a child to a facility where patients are lined up in the hallway, especially one that isn't geared towards children, is a major red flag for medical neglect or an attempt to bypass the strict reporting protocols of a traditional hospital. Why this setting is suspicious. Improper environment, nursing homes, and rehab centers are not equipped for pediatric trauma. They often lack the specialized tools and child life specialists found in an ER. Standard of care, leaving a child's head wound uncovered in a hallway where they are exposed to germs of other recovering patients, like the elderly person you saw, is not standard medical practice. Privacy violation. Treating a child in a public hallway is a significant breach of medical privacy. Such treatment may have been unofficial or under the table. Okay, so she wasn't treated in the hallway. I think AI misunderstood what I was saying. But she had to walk through the hallway of this facility. Okay. The possible facility they took her to was a facility called Sandstone Spring Valley. It's a skilled nursing and post-acute rehabilitation center in South Rainbow Boulevard in Las Vegas, okay? Now, why this is suspicious, okay? It says, your observation about the hallway beds and the specialized equipment align with physical environment of a rehab center rather than a hospital. Sandstone Spring Valley is a 160-bed facility that provides in-house dialysis and ventilator care. Large specialized machines kept in patient rooms are standard there, which differs from a built-in equipment seen at hospitals like Spring Valley Hospital Medical Center. So you would never see equipment like that at a regular hospital. At a regular hospital, the equipment are built in. You saw freestanding dialysis machines, you guys. So that's an indication that was a rehab facility, you guys. They took that baby to a rehab facility, not a freaking hospital, you guys. So who do they know that works at Sandstone Spring Valley? Is it Kevin's wife? Because this is crazy. Why would you take your child to a skilled nursing facility for stitches? And that's why that baby stitches look like that. Because it wasn't even done in an appropriate place. I've never seen stitches throwing up gang signs, uncovered, no band-aid. Like, it looks crazy. Okay. It says the facility layout, again, Sandstone Spring Valley is a 160-bed facility, provides in-house dialysis and ventilator care. And I'm going to show y'all the scene when they're walking out. You can see the ventilators all around. You can see an older lady in the hallway. Bro, they took this baby to a freaking... I can't even believe this. They took her to a rehabilitation center, y'all. A nursing home, essentially. Hallway beds at night are common indicators of an overcapacity or understaffed nursing home, but they are not standard for pediatric care. Medical oversight. Nursing homes have had documented deficiencies regarding infection control, resident rights, and using such a facility for child emergency care is highly irregular. Highly irregular. So they're doing some suspicious shit. Him and royalty, you guys. This is a bombshell. This is a bombshell. Do y'all understand what I'm saying to y'all? These people are doing suspicious, weird stuff with this little girl, taking her to rehab facilities to get her stitched up. That's why them stitches look crazy. Throwing gang signs because she didn't even go to the appropriate place to get care. Now I'm going to show y'all the video. I'm going to show y'all the hallway, and y'all going to see these freestanding machines. You have never been in a hospital where you would see stuff like this. This was a rehab facility for dialysis. We need to find out who works at that facility. This is a bombshell. I am so disturbed right now, you guys. I'll be back. Positive. Okay, so they walk past a lot of equipment. I'm having such a hard time capturing this part, but if you can see, it's oxygen tanks by the door. It's a whole bunch of equipment. They're gonna walk past a lady who's just sitting in a bed. You see how old and look. Like, this is not a hospital, you guys. This is just straight rehab facility, okay? I'm gonna see if I can take it back to when they first go down the hallway. I hate listening to this man talk. Okay, so they about to go out into the hallway, and you're gonna see all these machines. Okay, you see all these like that. Even though we in the most nastiest situation ever, as usual. You see that lady that's just sitting right there. Never would be at a hospital like that. A real hospital, you could tell how outdated it looks in there. All these chairs for treatment, and then it looks like they're gonna pass some. I'm saying this about her. They said they was calling these dialysis machines. I'm not familiar with dialysis machines, but just all this equipment that's just in the hallway, all these chairs, would never be at a hospital. This is like a treatment, a rehab or a treatment facility of some kind. Okay, when I put the information in to do an image search of what facility it could be, they gave me the name Sandstone. I'm going to do some more research to confirm this, but I believe this is the rehab facility Sandstone. They did not take that child to a hospital. Look at she's saying that about me, or she's linking up with my enemies, or I'm just trolling her kids online, but it's never really been good, and this is the most positive I've ever seen us. Y'all see all this, the oxygen tank and all that? This is not a hospital. What hospital looks like this? This is not a hospital, you guys. This is not.